I'm Gwenyth Fischer. I'm a pediatric critical care physician at the University of Minnesota in the United States, and I am also the director of the Pediatric Device Innovation Consortium, which is a group that helps inventors of pediatric-specific technologies. So there's many clinical needs in pediatric critical care and pediatrics in general. One of the biggest needs that I see is moving clinical care to the home setting, because we know that moving pediatric patients out of the hospital allows them to recover faster, and it also saves a lot of burden of the cost. So I think that one huge area would be to help develop better technology for kids at home, such as better home ventilators, better tracheostomy kits, and better G-tube care kits. Well, the first thing I think that needs to happen is there needs to be better customer discovery of the patients and parents at home, so that we understand what the challenges and barriers are at home right now. So for instance, I know that home ventilators alarm frequently, and what happens is the family then shuts off the alarm because it's 3 in the morning and the alarm has gone off 20 times. That family can't sleep or operate if the alarms are going off constantly. The problem with that is now the family doesn't have an alarm on that ventilator. So working with companies to create better alarm systems for the ventilators would be the first place I would start, to make something more friendly for non-clinical operators at home. So beyond moving patient care to the home, I also think there's a lot of areas for improvement in prenatal and perinatal care, as well as care of the premature infant. We have, thanks to medical science, we've been able to have premature infants survive at younger and younger ages, but all those infants have chronic diseases that I think that we can work to try and alleviate and prevent. So for instance, many infants have a buildup of fluid in their head when they're born very premature, and we have something called a ventriculoperitoneal shunt, which is a small tube that drains that fluid in place. The problem with that device is that there is a very high infection rate and a very high obstruction rate, and so working with companies to help reduce the infection rate on those tubes is one example. I also think that more transformative technologies like discovering and creating the artificial placenta, which some groups are working on, will have a huge impact on pediatric care.